Good afternoon and welcome to another edition of Inside the FLX. I'm Josh Durso, and as always, we are coming to you from the FingerLakes1.com studio in downtown Seneca Falls. We have a very exciting show today as we welcome Petrea Rae of the Partnership for Ontario County, who joins us in studio to discuss substance abuse and a bunch of other interesting things. Petrea, thank you so much for coming on.
Thank you for having me.
So, first of all, tell us a little bit about yourself, how you came to the area, your personal background, because I think you have a really interesting story.
Well, thank you, Josh. I actually am born and raised from Springville, New York, a little bit south of Buffalo. I went to St. Bonaventure University, and then I was living in the Buffalo area working for Canisius College, and then my darling husband, I will say, got a job in the Binghamton area, so we moved to Binghamton for about the last 5 years. And then just about a year ago in July, we moved to the Finger Lakes area to Canandaigua, as my husband got a job at Finger Lakes Community College teaching culinary arts. And so I joined the partnership 1 year ago tomorrow.
Mm-hmm. Well, congratulations on that anniversary.
Yes.
Now, tell us a little bit about the partnership itself, what it is, how long it's been around, because it has been around for quite a long time, its function and sort of how it impacts the community.
Yes, thank you. So the Partnership for Ontario County was incorporated in 1998, and we really focus on youth, family, and the community. Through our efforts, we have 9 programs and initiatives at the partnership. The Substance Abuse Prevention Coalition is one of the initiatives, but we also have the Child Advocacy Center, Youth Court, Family Support Centers, which is located in 4 school districts. That would be Mid-Lakes, Marcus Whitman, Geneva, and Canandaigua. We have the Youth Clubhouse program that also works with substance abuse, and that allows a safe space for youth to go to at the Geneva Boys and Girls Club, and then in September at the Canandaigua YMCA. And then we also have some initiative-type programs like myself, which is with Youth for Youth, which is really making sure that we focus on youth and involve them in the conversation as we plan our programs. We have the Nowhere to Go program, which looks at homelessness within Ontario County. And then finally, we train people on youth mental health first aid. And so we do have some trainings coming up, and I'll make sure I get you that schedule.
Awesome. So give us, if you could, Petrea, a little bit of background on sort of what substance abuse, what the trends are in the area, what you guys sort of see typically, what things are on the rise, maybe what things are on the decrease. Just sort of give us an overview, if you could.
Okay. Yeah, no, not a problem. So we are currently, for our coalition, funded to look at the heroin and prescription drug epidemic. So we really have been focused in on that. But we did collect data on all the different substances out there. So we're still seeing underage drinking. We're still seeing marijuana use. We're still seeing tobacco use, along with the other drugs outside of prescription and heroin. That being said, one thing that we didn't collect officially on a survey, but we have in focus groups, is we're also seeing a huge rise among youth in regards to e-cigarettes. And so we're kind of tracking that. And then one interesting trend that we don't really know what this means in our coalition world is we saw a huge amount of use of energy drinks. And we kind of thought that was interesting. We don't know if that's, meaning that it's kind of getting them used to that high sugar, high caffeine, and that might lead to other things. We're not sure, but it was interesting. And then one other trend point that we thought was really interesting is there's a really low perception of risk around marijuana use. And I don't know if that's because of the legalization, if it's because, as one kid told me, it's natural and organic and it grows in the ground. And we surveyed 2,000 people between the ages of 12 and 25, as well as community members, community leaders, when we were doing our surveys, and that was the lowest perception of risk out of everything. So.
Now, sort of on that, you just nicked on something I feel like is kind of interesting. What is the sort of perception versus reality?
So perception is just what they think is going on, and that's kind of what we want to know. Do you think all of your friends are getting drunk on a Saturday night? Do you think all of your friends are smoking marijuana? That kind of stuff. And then we do ask them your personal use question. So we ask 30 days, and we ask lifetime. Okay. So. Does that kind of help?
Yeah, that's pretty interesting.
Do you think everybody in your community is smoking e-cigarettes? And and then also, what's the risk factor? Do you think you could die from smoking marijuana? Do you think you could? So.
Now, do you think that sort of that perception problem could does it desensitize students, young people to the concept of like using drugs? Is that sort of
it could. So if people are thinking everybody's doing it, they might be more likely to try it. And so that's actually one of the things that we're working on as a coalition is raising awareness about risk and changing that perception of risk around heroin and prescription drugs. So thank you for kind of letting me explain that.
Now, what is the if you had to sort of identify one or two or maybe even three, whatever the big sort of challenges are with combating substance abuse in the Finger Lakes, or even more broadly, what are sort of the roadblocks for you guys?
Yeah. So I think the number one challenge is that perception that it's not in my community or it's not in my family. And so one of the biggest things that we're trying to do is raise awareness about what is really going on. And that's why the survey was so important, because it allowed us to say, here's what, the 30-day use is, the lifetime use is, here's what the perceptions are. And then also, as we were doing that survey, people were sharing with us their own personal stories. And I don't think I encountered a community that somebody didn't have a story to share when it came to substance abuse. And then more specifically when it comes to heroin and prescription drugs. So I think it's changing that that understanding that it can happen in your family and it can happen in your community, if that makes sense. So, and then...
No, go ahead.
And then the other thing I think is that we are covering all of Ontario County with our coalition work. So every community is different. And so what we, as I keep alluding to, we have strategies, but what we're trying to do is take those strategies that have been assigned to us and making them unique to the communities that we're working with to make sure that we can really address them in those communities, if that makes sense. Because we have rural areas and we have highly populated areas. We have a Spanish-speaking population. We have, elderly, so.
It's a very diverse region and a diverse problem.
It is, yeah.
Now, does that sort of lead sort of into what we were going to talk about, how you guys have to approach dealing with it, how you approach, it would almost seem as though you're not going to be able to tackle X, Y, and Z problems with 1, 2, 3 plans. You're going to have multiple. Dozens of plans, sort of layering, right?
Yes. So what I say is it's a multi-tiered approach or multi-pronged approach, and really what it comes down to in my thought process is it's partnering with everybody and anybody. And so, we partner with law enforcement, we partner with the medical community, we partner with all of the school districts, all 9 school districts around Ontario County, the faith communities, and then community members. And so with all those partnerships, we can attack it from many different angles. It could be community education. It could be, getting people to have that conversation, maybe changing some policies. It could, whatever it is, but it's community-wide and kind of a multi-tiered approach, because as the sheriff will say to me, we can't arrest our way out of this problem. We can't, we have to do prevention and kind of educate our way out of this problem, and it's educating everybody and anybody that we can.
Now, another one of the little items we were talking about before we came on was the whole concept fighting, because I had said one of the things I saw while I was doing a little bit of research for the show was the tagline, fighting crime by treating substance abuse. Just talk to us a little bit about what that sort of mentality or approach means to you as someone who actually is fighting this issue.
Yeah. Well, when you first told me that little tagline, what I thought about is that, when I speak to the jail community or I speak to law enforcement, they encounter a lot of people who come to their doors because of things like burglary or DWI, but really the underlying issue is they're fighting some sort of substance abuse. And, so they're coming into the jail system and, and I don't know if I have these numbers exactly right, but, a large percentage of them, around 70%, walk into the jail and they're dealing with some sort of substance abuse. So they're doing criminal activities to support that substance abuse, but not so they have to have that treated as well, and so if we want to see a reduction in crime, we have to recognize that sometimes there's an underlying issue that brings them into that door.
Now, one of the things that you said was a really sort of piece of positive news was that you guys have been able to work towards destigmatizing substance abuse in general, and that has helped in getting the message out there. Talk to us a little bit about that part of the fight.
Yeah, I think one of the goals is to destigmatize it for family members and for people who are in the grips of it, and siblings and pretty much the entire community. One of the things that we're always saying is if we raise awareness about this and people can share their stories, hopefully that will prevent somebody from going down that road. And allowing families and loved ones and even the person who's maybe in recovery or in the grips of addiction to say, I'm not alone and it's okay to talk about this. A lot of families tell me they feel shameful, and we don't want that to happen. Do you know what I mean? We want you to understand that this could happen to anybody. And that's why it's important to have that conversation, to educate your children or anybody who you might think is at risk about the dangers of this. So.
Now, what kind of sort of toll or expense does this take on rural communities? Communities like some of the more rural ones in Bloomfield, for example. I'm just trying to think of smaller places in Ontario County. What kind of, challenge would they have as opposed to Geneva or a Victor or, some of the larger Canandaigua?
Well, I think, that's a little bit different than I was expecting. I think it takes a toll on any community, but even in rural communities. So it's going to take a toll on your law enforcement that might have to respond to those crimes. It's going to take a toll on your EMS and firefighters if they have to respond to an overdose. They have to be trained in Narcan. They have to respond to that. They have to see things that maybe they weren't expecting to see. It's going to take a toll on the larger community, and just like what I referenced before, if, there is criminal activity going on, then your community gets a sense of that. And then I think finally, no matter where it is, it's going to take a toll on those family members and potentially employers. Family members because they have to deal with paying for recovery, the stigma that we just talked about, and figuring out a new way to kind of cope with this. And then I had written down employers, because when you think about loss of productivity, if somebody's dealing with a substance abuse issue, so that could be in any community, so I think it can take a toll,
Now, what you're describing are sort of wear and tear issues. What are sort of some of the warning signs of substance abuse? I feel like a lot, you have, some people have that image, that old school image of like the junkie in the alleyway.
In the back alley,
in the 70s, but that's not it at all.
No.
Give us sort of the rundown of things you might see if someone is struggling with substance abuse.
So one of the first things that I think is a warning sign is if they suddenly become very secretive, not telling you where they are, not telling you what they're spending their money on. You might see things missing from your home. Maybe you had $60 in your wallet and it's then gone, or your coin collection's gone, or your drum set's gone. That's like telltale signs.
Yep.
I think change in demeanor or appearance, change in friend sets. Like let's say they were really popular and they start to isolate, or they were maybe not so popular, and they get this new set of friends that you've never met, you've never seen. And then, there's the physical symptoms. One of the things that I hear a lot, and I deal mostly with heroin and prescription drugs, but one of the physical symptoms that I hear a lot about is this flu-like symptom that, your child or your loved one, could be in their 40s, suddenly has this onset of flus, which is what we call dope sickness. And but they don't want to go to the doctors to get it treated, and and then their eyes, they can either have really large pupils or really pinpointed pupils, but it's not appropriate based on the lighting.
Right.
Irritability, anger, apathy towards the situation. There's a lot of telltale signs, that kind of lead to it. But the one thing that I hear most often is the dope sickness is like the number one sign. So, and there's this one little thing that I hear when I do community interviews, but something that's really random that might go missing in your house if you're dealing with somebody dealing with heroin is spoons, because they use the spoons to heat up the heroin. So if suddenly your spoons are missing, that might be a telltale sign.
Right. So how do you guys go about reaching young people, kids? Obviously, getting to kids while they're young has to be beneficial.
That is the number one thing we are trying to do, is reach that 12 to 17-year-old population. And so the way we're doing it is we've partnered with all 9 school districts to either do some sort of educational programming. In the last, I'd say 14 to 15 months, we've done 14 heroin forums across the county. And half of those have been in individual school districts where we present the information directly to students. It's a pretty powerful thing what we are doing. It can be pretty graphic. We have someone in recovery who speaks about what that experience was like. How did they start on this path? Did they start with, what people commonly think is painkillers, or did they start on the alcohol and marijuana path and then switch to something like heroin? We have a parent who shares his story about losing his son, or if he's not available, another parent who can share her story about her son being in jail and the recovery process of that. We share the overdose, what to do if you encounter somebody who's going through an overdose, and the Good Samaritan law. Law enforcement sometimes speaks depending on the venue. And then we have treatment that speaks. And we do treatment in two ways. We have FLACRA, who speaks from their treatment angle, and then we have Narcotics Anonymous, who speaks from the more holistic, self-treatment.
So one of the things that you've mentioned a couple times now that I really wanted to give you a chance to talk about a little bit is the Narcan.
Okay.
How that has sort of helped, or if it hasn't helped, or what sort of the repercussions have been from adding that to the repertoire of ways to slower combat it.
Yeah. So the thing with Narcan is it's a prevention for overdose. So if an EMT or a police officer or anyone encounters someone who might be going through an overdose, they can administer Narcan. Narcan comes in three forms. There's a nasal mist form, an injection form, and an auto-injection form. And so, you can administer it to somebody. The really nice thing about Narcan is if they are not overdosing from an opiate, it's not going to harm them. So that's what, we kind of preach. If you think that's what you're encountering, it's better to be safe than sorry. Always call 911 before you administer Narcan and get them involved. But, what you're seeing is, and I gave you an example just the other day, I got a news article on my listserv that in West Virginia, I think it was 27 people overdosed in 4 hours. One of them was fatal. But I'm guessing that the article didn't say whether or not, but I'm guessing Narcan was involved in saving those people's lives. So it is controversial. People, have this image of people getting high and using Narcan, and one person's available to kind of help. The reality is we're saving lives by using it. And so I think it is important for the community members to be aware of it. The nice thing is that you can get trained in it at your public health office, as well as you can get it at certain pharmacies. I know CVS does have it available for purchase. So if you think it's something that you might need, you never know where you might encounter somebody who might be overdosing. It could be in the bathroom at Burger King.
Well, doesn't that go really a long way to sort of saying if a county is willing to start training civilians on using anything to prevent it, that should sort of ring the red bell, so to speak. What do you, as a broad, large coalition, what kind of benefit do you guys have in being able to sort of spread your arms around a problem and really tackle it? You aren't just focused on Canandaigua, or so talk to us a little bit about your ability to reach the whole county and how that actually can impact the way.
I think that's the beautiful concept of this, that it's not just in one community or one school district. We are looking at the entire county, and we are trying to raise that awareness countywide. We're actually focused on 4 strategies, and I'm going to throw those in here for a second because I haven't yet. Our first strategy is raising awareness about restricting the availability of prescription drugs at home and asking people to monitor, secure, and dispose of their medications that they have. And that's really kind of looking at what's in your medicine cabinet, what might be on your kitchen counter, what might be in your pantry, and saying, am I keeping this in a safe place, number one? Who has access to this? And I even joke with people who say, well, I live alone, I don't need to worry about that. And I say to them, but do you have repairmen come in? Do you have a landlord? Anybody could come in your house and have access. So it's really making sure that you're keeping them in a safe place. If you have a narcotic, even if, funny as this may sound, you have a narcotic for your pets, that you lock those up. And then finally, you properly dispose of them. And we have a number of locations around the county. So then the second thing that we're doing countywide is, I realized as we were doing these surveys that we only had 4 drop boxes, one being in Victor, one being in Canandaigua, one being in Farmington, and one being in Geneva. Well, those rural areas that we've talked a lot about didn't have access to them. So we're expanding those drop boxes so that people in other areas can easily drop off their medications. And why is that important? Well, it's important so that they don't fall in the wrong hands, but it's also important for our environment. When you think about, you don't want to throw it out, you don't want to flush it down the toilet. So having a place that you can securely drop it off, that it goes into the hands of the sheriffs, and the sheriffs take it and incinerate it, is great. And then the other thing that we've talked about is raising awareness on risk. And, when we think about substance abuse, it's what is the risk to this? And so we are trying to raise that awareness community-wide on what are the risks to heroin addiction, what is the risk to prescription drugs, and, what is the risk to substance abuse. And a subset of that is making sure that any supportive adult in a child's life in any community can have that conversation with, and I keep saying child, but anybody who you're concerned about that might be abusing a substance or might be going down that path. Mm-hmm. Having that conversation about what does this really mean and what are the risk factors with it.
Now, with that, sort of from your perspective inside the fight, what is that stigma? Because I feel like that's another stigma where some people think that it's just people under 30 or under 25 or just kids. It's also older adults as well. Talk to us for a minute about that, because I think that's worth mentioning.
Yeah, so unfortunately I get the death data, and I've seen every age. Do you know what I mean? Yeah. In that, and you see it on the national news as well. People who maybe get a cancer diagnosis at the age of 40 and get hooked on something, then get taken off of it and might turn to street drugs like heroin. And you can also, we always kind of say you overdose from heroin. You can also overdose from the prescription drugs that you're prescribed as well. So, we're kind of combating both of that. But it can hit any age bracket. And unfortunately, the reason we're doing prevention from that 12 to 25 is that a lot of the deaths are 25 and older. Not saying that there's not younger deaths, but a lot of the death data that we see is that 25 and older. So it can happen in any community, any place, any age. That's the reality, you know.
You guys have a couple of drug collection days.
We do.
Coming up.
We have one on September 24th in Victor, and that's a mobile drug collection day. So you can just bring any medication that you want to bring, over-the-counter, pet, or prescription medication, and you drop it off. It's kind of like a drive-through. You just pull up, and we come with our little containers. We collect them, and we put them in a box. They get weighed and burned up, which is really awesome. And that's from 9 to noon at the Victor Village Hall on the 24th of September. And then, like I mentioned, we have the permanent drop boxes. And so we have currently installed Mead Square Pharmacy in Victor, the Farmington State Troopers, the Canandaigua DMV, and the Geneva Police Department. And soon we will have one at the Bristol Village Hall, FLCC near the Health Services on the 3rd floor, the Medicine Shop in Canandaigua, and the Clifton Springs Hospital. And then we're working on Phelps and the Gorham area. So,
now, for the average person watching or listening, what are sort of some of the things that they can do to contribute to helping the cause, so to speak? A lot of people are seeing it, they're hearing it, but they're scratching their heads saying, what can I do?
What do I do?
Talk to us.
The first thing that I say is have the conversation. Do you know what I mean? Like, continue this conversation. Say, hey, I saw this podcast and I want to learn more. Research it. Have the conversation. Come to a forum or another community event. We're also rolling out community cafes, which is another piece of education, where we let the community members, we do like 10 minutes of education, and then we pose 2 questions to the community and have them answer it, kind of based on their community. So come to an event. And then we're always looking for volunteers at our coalition. We are 100% volunteer run, except for myself and a data person. So if you want to really fight the fight, we are grassroots in every single community. And that can be as simple as, what my email yesterday was, I've got magnets to drop off at pharmacies. Does anybody want to drop it off at your local pharmacy, which tells you where to dispose of your medication? Or it could be planning an event, or it could be running our Twitter campaign, because we currently have a Twitter campaign going about what I didn't know about heroin. So it could be any of those things. So, but I think the most important thing is what we just said earlier, is have that conversation, and have that conversation with everybody. That this is what addiction looks like, this is what can lead to it, this is what can cause it, and this is how we prevent it.
Now, before we get you out of here, I would like to ask you just briefly about that. A Twitter campaign, social networking, social media. How have you guys sort of integrated that into the fight? Talk to us about that.
Yeah. So we currently have a Facebook account, a website and a Twitter campaign. They are all really new in the last month. But our goal is to use all of those mechanisms to kind of blog, put articles up. And our Twitter campaign is probably my little favorite one right now, because we actually interviewed people in recovery and we said, what would you like to have known before you went down this road? And I interviewed 6 people. They filled up full pages with just simple comments of, I wish I would have known this, I wish I would have known that. And they just talked, 15 minutes to a half an hour piece of what they wish they would have known. And we're now doing that as single Twitters of, I didn't know heroin would. And just, and it can be as simple as, like, one of my favorites is that I'd hang out with people that criminals wouldn't even hang out with, or that it would steal my soul. And or it would steal my dreams. And so it's kind of an extreme, because we're talking extremes. This is directly from the voices of people who were in 28-day recovery programs, saying, this is what I wish I would have known. And so I think it's kind of cool. Yeah. But, it's the things we don't talk about. We talk about other things when it comes to this. We don't talk about what's the reality,
Well, we really appreciate you coming on today. We will definitely be having you on again, because I don't think this issue is going anywhere anytime soon, unfortunately.
Unfortunately, I don't think it is. But I thank you. So.
Absolutely. Well, that's going to do it for us today. I'd like to thank Petrea for stopping by and remind our viewers to check out the partnership's website, which we will have linked on the website below. As always, Inside the FLX airs Sundays at 7 p.m. on Time Warner Cable Channel 12. And, of course, the podcast is always available on iTunes, Stitcher, and the FingerLakes1.com app. For Petrea Rae, I'm Josh Durso, reminding you to join us next week on another edition of Inside the FLX.